thank you so much, Devika ji, for giving us time, and everybody, thank you so much for your attention. See, look at every problem is increasing. Diabetes, PCOS, hypertension. Now, it cannot be the case that human genetics is weak. Because of that, we have diabetes or thyroid problems, or because of that, we have hypertension. It's not about human genetics at all. But conventional medical system has made it look like it is a genetic problem. It is not a genetic problem. That's a very important point. And a point for us to remember as wellness practitioners to tell to our clients, it's nothing bad with your genetics. Genetics is almost okay. 99% of the cases, genetics is okay. Okay, please don't worry about genetics. It's a flawed theory. Okay, but more than the genetics is the epigenetic, which is the problem. The factors which can impact the outcome of the genes. Your nutrition, your toxins, your lighting, your hydration, things like that. If epigenetics is bad, then genes can manifest a problem. If we improve the epigenetics, the conditions around the genes is improved within the body, outside the body, things will improve. That's how the nature of the body. Body is meant for repair, regeneration. It's constantly we're repairing, regenerating. So please, first thing we should tell any of our clients, healing starts with a positive mind and thought. If somebody has told that client that this cannot get better, the person will never get better until we intervene, tell them, Baba, remove the thought, take a fresh thought, things will get better. Okay, so functional medicine gives us a tool set. How do we understand the disease better? That's functional medicine. If somebody is diabetic, why the person is diabetic, which kind of diabetes this is. Then you can use your nutrition as a tool, your supplementation as a tool, or any other treatment modality to solve that puzzle. Functional medicine is a methodology to understand the problem better. It's not about supplementation. It's about knowing the problem better. Now, once we know the problem better, we know what do we convey to the client, what do we convey to the patient, and what is the strategies to solve those different issues in the body. So it's not about this and that. It's about looking the whole thing. Now, disease burden is increasing, as we all know. Human genome remains constant. Human genome remains constant. If human genome was the problem, then we should see a change in genome, but which is not. But certainly the environment in the body is changing, increasing the gut permeability, bad microbes, which is in chronic infections, poor diet, toxic overload, dysregulated immune system because of stress, circadian biology, we don't get sunlight, we don't get darkness, electromagnetic fields from the man-made devices, non-native electromagnetic fields, things like that. These all variations in the epigenetics is causing a trigger to manifest a disease. Not that body is meant to be so much diseased. This is something we have to tell our clients. They can get better. Let us not just simply, keep blaming the genes. In the regular system, there's one diagnosis and there's one drug. Multiple diagnoses, multiple drugs. Okay. And sometimes diagnosis does not tell you what is the problem. Diagnosis is only a label given to a problem, but it might not even cover up the whole problem. And more importantly, it doesn't tell what is the problem. Until we know what is the problem, how do we even attempt to solve it? So in functional medicine, we are not so much bothered about what is the label for the problem, what is the diagnosis. We want to know what is wrong in the body. What is the problem within the body? As we define the problem, then we put strategies to solve the problem, it gets better. But when we have one diagnosis, one drug, one diagnosis, one drug cannot solve the problem. Temporarily, it's okay. But drug is not. So one problem could be caused by multiple trigger points, or one kind of a trigger point can cause multiple diseases in the body. Okay, so it's not just one-to-one correlation. So when we are looking at the disease, we have to look at it into more entirety. Okay, when we do functional medicine, yes, we have to churn out more data. We have to look at more data. We have to look at the problem from different angles. What could be the trigger? And accordingly, we have to fix it. Okay. So, like I said, there are few things we are keeping in mind, few pillars we have keeping in mind. Your diet, your lifestyle, your food, your chronic infection, your nutrition, your toxicities, your organ function, things like that, our immune system. If we know these problems and how do we tackle these problems, then yes, in 90% of the cases, you will have flying results. Sometimes the mind of the person is so tough, maybe we'll have a challenge, but 90% of the cases, without hands down, we can solve it. But interesting is, it's patient-centric. If we tell them you have to follow 10 things, but patient can say, I can only follow 8 things. But okay, you only follow 8 things. That's fine. Maybe not 100% the patient is doing, but whatever he's doing correspondingly, the patient will get results. Okay. If he does more things for himself, herself, they have more better results. Less things, still some results. So, but we want to ensure that we don't pressurize and, we tell them this is the only way, things like that. We say, this is the plan. You follow as much as you can. Accordingly, you can. It's a patient-centric. We listen to the patient. We take account. The guy is also accountable. It's not just our responsibility. The other side is also responsible for their wellness and outcomes. Also, we're trying to bring a balance in the body, which is being changed by the lot of dynamics. Something increases, something decreases, and then things like that, and then outcome can change. So we have to keep looking at these things. When we are treating a patient, we have to look at dynamic things in the body. Okay. And we have to look at the organ system interconnectedness. Immune system dysregulation can cause IBD, can cause psoriasis, can cause Hashimoto's, can cause brain dementia, things like that. So maybe different problems, but ultimately immune system is dysregulated. Until we stabilize the immune system, things will not get better. So we need to know where is the problem starting, what is the connectedness of these problems and within the organ systems. Okay. And every time we can test each individual, look at the biochemical individuality, look at each individual, see what is wrong in the body. Doesn't matter what is the problem. Doesn't matter what is the diagnosis. We just still want to understand what is the problem. So these are basically, I'm sure you all might be knowing all of these things. We're trying to bring more powerfully these intentions in your practice, that we are willing to look at all. Ultimately, we have to improve the digestion. We have to improve their immune system. We have to reduce their inflammation. We have to improve the energy production by improving the cellular mechanism, their mitochondria. We have to improve their circulation, blood circulation, hormones, and structural integrity and detoxification. Now, doesn't matter what is the problem, you focus your treatment plan around these fundamentals. You want to improve the detoxification, improve the digestion, improve the repair, improve the structural integrity. Just these 7 fundamentals, if you look at it, most of your clients will just like the recover. So it's not so complicated also. Even though we churn out a lot of data, we look at a lot of things at a time, but we can always start slow. We can always start simple. And as we build on to our practices, we learn from each experiences. You can become more, complicated in your practice, but you don't have to start with the most complicated things.